So, and again, I think that's where a lot of people think they must not be buying the right topicals because now they're still, feeling that they're aging or looking older. And I
Hmm.
think it's where structure, is such an interesting subject, right?
Oh, it's.
I always love to think, tone, texture, volume, right? And I
Hmm.
think people are they're focused on tone, meaning dyschromia, right? Like where they've got redness or brown spots, or they're focused on those texture things, like where their pores start to get bigger, but they're
Hmm.
not oily, or they've got more wrinkles.
Hmm. And
But
they
really, yeah, the volume, the structure underneath is just
yeah,
so important.
yeah, it's all part of it's all part of one package, and that actually speaks to why we look at all those things when we look at interventions too. And I'll kind of go back to that. So when you look at an older person, the first thing you might notice is skin tone and texture, like you talked about, pore size.
Mm-hmm.
But there are other subtle things that happen to us as we age. So, when we look at a young let's start with infancy, right? We look at an infant, their face is very round, it's very full.
Mm-hmm.
Their proportions are very different. So, they have a larger mid face typically, and then their chin is kind of smaller.
Mm-hmm.
And then as they grow, the chin sort of starts to elongate some. And in adolescence, you still have some roundness to the face and fullness centrally. And then as we get into sort of our 20s, we sort of start to thin out. And I would argue that women sort of in their mid 30s to mid 40s to late 40s, to me, they look the best. They look
I totally feel like
amazing.
that. Yeah, like
Uh,
I look at pictures of when my kids were first born. I was like 32 and then 36. And I'm like, that's when I felt my best
right?
because I'd started to lose, some of this. It started to thin out a little bit,
You
right?
get some more contouring. So, in
Mm-hmm.
that age group, you start to get some contouring, some height in the cheekbones, some thinning down in through here. And it just looks nice. I love that age, I guess. Then as you start to, continue on down this process, what happens is you start to lose height in the chin.
Mm-hmm.
You start to lose some volume, further lose some volume in the cheeks here. And our skull actually starts to lose volume too. We talk a lot about shrinking in height, osteoporosis and all that when it comes to managing health, but we don't think about how that extrapolates to the skull. The skull changes as well,
Mm-hmm.
right? So we actually start to shrink in our skeletal structure, and the calvarium, this part of our skull actually shrinks, but so does our chin, and the mid face starts to shrink too. And interesting things happen, to how we start to use our muscles over with as we age as well.
Right.
One of the most obvious things that I see when I see people is when the chin shrinks. The length between, so you have muscles that come from here to here, they attach here and here. As this length shortens, these become hyperactive, and this is a phenomenon that physiotherapists are very familiar with. Like if you have an injury and you hold your shoulder in a certain position, you shorten the length between the attachment of the muscles, and you'll get more tension in that muscle, right? So we get tight shoulders and so forth. The same thing happens to our facial muscles as as this height shrinks. These start to become more active, and we start to see this business going on, and people do not like that. Sometimes we manage that with neuromodulators like Botox, right? But sometimes we actually will increase chin length, and that will actually change things. Um,
And the thing I love when you do that is those typically from that side view when people are finding their jawlines getting soft, by
right.
projecting that chin forward, it gives them much more of definition. It's
Yeah.
amazing
Yeah.
sometimes.
So we shrink in height, we shrink in the skeleton. And I sometimes will tell people, we talked about the skin already, and we do so many lives and whatnot on skin health and lasers and all that, but it we also have to remember that it's almost like it's like a balloon, right? We're like a balloon and with a sheet over it. And as we age, there's a little bit of air that comes out over time gradually. And this business happens, right?
Yeah. So if you find yourself in the front of the mirror doing this,
Yeah.
that's more than likely some volume loss, right? And
Probably.
tell, and how much volume do people typically lose, say between 30 and 50? Because I find, I'm 50. 50 is where I'm starting to notice like market changes.
Yeah, and people will often say they'll hit a certain mark where it's like, I'm fine, I'm fine, I'm fine. And oh, what the heck happened, right?
Mm-hmm.
And there's this little tipping point of volume loss that I think occurs at about half a cup. Once you lose about half a cup of volume in your face, you start to see that. And that's typically about how much people will lose between 30 and 50, right?
And then we continue to lose, right?
Yeah, at
Every
about
year.
the rate of about a teaspoon a year, we'll continue to lose, right? And that's responsible for many things. We have a viewer here
Yes.
asking about hollows. Why are they becoming more pronounced? Hollows under the eyes, and that's such a typical thing that we hear. I'm looking tired. I look tired. I don't know why I look tired. And my under eye area, I'm sleeping enough, but it's not really reflecting the energy that I'm feeling, right?
Mm-hmm.
So that's also happening because of volume loss. We just talked about skeletal volume loss, losing volume in our calvarium here. We also lose volume skeletally in our midface. It starts to sink back. And the other thing that happens is we lose fat in our face, which is unfortunate because we gain it elsewhere, at least in
I know. And it's like you said, if you're somebody that's kind of always carried your weight here, once you sort of hit menopause, it's like,
yeah,
it wants to even join on there. But I think in terms of the eyes, so when you talk about bone loss, because this bone kind of goes like this, does it not?
It does, but what also happens is this fat pad here starts to shrink. We lose fat in our face too, right?
So,
Not only,
so
and
it
then
kind of opens.
yeah, and
Yeah.
the eyes shrink back. We lose volume here too. This is always interesting when we revolumize the teeth.
Yeah, it's
People
pretty cool.
don't realize how that adds to the eyes looking tired too. And we'll kind of get into that in this series of 3 that we're going to do this month about aging and so forth. But what happens under the eye, specific to your question, we lose volume here, and this fat pad, because of gravity, kind of goes lower. Even when I do this, you can see how my under eye area looks a little bit less perky. And you start to see the delineation of the orbit from this fat pad, and that delineation adds to that tear trough hollow that we see. So oftentimes when we're trying to make people look less tired, we actually focus up here. Like, bring this up, and you can see when I do this, my eye on that side looks more refreshed, right? Mm-hmm. So that's what that's about. So I hope that answered the question that you had.
Yeah.
So volume loss.
So it is bone, so we lose bone density.
Yeah.
And then, like you said, we're also losing volume in those fat pads, right? Mm-hmm. And we have a lot of them, don't we?
We do. We have so many. There's this nasolabial fat pad here. There's the, malar fat pad, the SOOF. We have fat pads in through here. We have fat pads in our foreheads, guys. So people will start to get this hollowing and bossing of the forehead that reads a little bit older.
And can also kind of make the eye kind of come down, right? Because it's lost that ability to tent the skin.
Exactly. So when we start to see the eyebrow falling laterally, that's another complaint people often have, is that the eyebrow is falling some, or they just feel like their eye. Some of it is volume loss in the forehead itself, and some of it is often forehead loss in the temples here. Mm-hmm. And you'll get this sort of peanutting of the silhouette of the face. People often don't look at that and don't realize that that's adding to their discomfort, or they're feeling like they're not looking quite themselves. And when we do a formal assessment, we sit down, we do a consultation, we really do analyze the face very carefully and then try to understand the things that are bothering people, right?
And build a plan for them, right? And I think that's something important to talk about is, treatment plans.
Yeah, so we'll build a plan based on sort of what is catching the eye, what is the most bothersome thing. And it's going to be different for different people. And that's why I've never been a huge proponent of cookie cutter or color by numbers or, you know, that type of approach to aesthetic restoration, because it doesn't always work for every person. And everybody's motivated by different changes that we see, right? For some
Mm-hmm.
people, it really is the dyschromia and the skin texture
Totally.
that is bothersome, because it reminds them of that bad burn that they had on this trip, that just, you know, the trip wasn't great, the burn wasn't great, and
Or
they
they've
don't want
got
to see
that,
it.
or they can see that dark spot like their mom or their aunt has, and they're like,
Exactly,
I
right?
don't want that.
Yeah,
Yeah.
so depending on what the main concern is, that might be where we direct people, right? Whether it be a laser or topicals or whatever.
Mm-hmm.
But then, you know, speaking to things like temples, right? People will often come to us having had aesthetic interventions, but there's still something not quite working out the way they thought, or they're still not happy. They may not understand why, and sometimes we'll look at very subtle areas like the temple, and they'll realize that when you get a peanut shape to that head, it just reads old. And so
Yeah.
we sometimes we'll say, okay, well, if it's not working for you to have volumization in that area for whatever reason, you know, let's look at your hairstyle. Like I've done that before.
Mm-hmm.
Or say, okay, well, let's do this. Let's have, you know, style your hair like this. It'll read better, and that sometimes will buy people a few years or whatever they need to come to a decision as to how they want to approach the aging process that they're
Well,
seeing.
and there's so many of these things are sort of, I don't, subliminal is not the right word, but like things that we inherently subconsciously read as older, but if you don't know, you don't know, so you can't put your finger on it, but
Yeah,
it can often be hollow temples or softened jawline or square jawline. I know a lot of, you know, I'm that way myself. As my family, as we age, you know, a lot of people, they're more oval when they're younger, and as we age, we drop and we get heavy in the jaw and we get more square.
yeah, and it just reads more masculine. And
Yeah.
I think
Yeah,
that's also something we should talk about, is the
for sure.
trajectory of aging. You know, we have physical aging where we have changes in the face, and then you have psychological aging, right, and all that. And I think in this age, so 50s, you know, late 40s to mid 50s type of thing, most women that I talk to, most men too, um, they're feeling really confident in their skin, right? They're feeling really confident in their professional life. They pretty much know who they are, what they want to do, what works for them, what doesn't work for them personally, and they feel good about saying no to certain things and yes to certain things. So it's a really good space psychologically for most people. However, it's not always reflected in the mirror. And that sort of this happening to the face, but this happening, you know, professionally just doesn't
Totally.
right?
Totally. I still
Doesn't
tell you that story about my aunt years ago when I was in my 20s and she was in her late 40s. And she said, I feel like I'm 27. But then I walk by a mirror and go, right? It's
yeah.
like, because we kind of feel like, yeah, like the inside and the outside are not matching,
Yeah, exactly.
you know?
So
And I think we'll probably talk about this in another, there's just so much to talk about, but that guilt that a lot of women feel, right?
yeah, I don't know why that is. I think that's different for millennials, right? Like I talk to a lot of men and women who, but I find it more common in women where we feel really like there's something cultural about doing Botox or doing fillers, and it could be that it just wasn't done well years ago, right? Where
Well,
it's
we know
super
that's for
obvious.
sure.
Yeah, right. It wasn't. It was super obvious. It wasn't necessarily based on physiology of how we age, and there was dissonance, right? So going back to what we were talking about with the skin and the structure having to match, I think that's important to look at too. That
Uh-oh.
you're making sure that your skin looks youthful. The volumization is similar in terms of the youthfulness you're presenting. You know, I so often have this conversation with people where we say, well, you know, okay, we can do your lips, but we need to address this other area of the face so that the lips look the same age as the
It
rest
has
of
to
the
make
face.
sense.
It has to make visual sense, and that's how you get a natural, comfortable aesthetic at the end, right? It's all got to match, and that means you have to know how the face ages, how the skin ages, and you have to reverse those in order, right?
Right. Yeah, it does. Yeah, we've all seen people, you know, the more mature woman with the weather-beaten skin and, you know, the lack of volume and then these lips, and they just look,
It looks dissonant, right?
it's
Doesn't,
very strange.
yeah, so we want to, we just want to be aware and make sure everything is flowing nicely, right? Yeah, so that's why I think, and everyone's going to have a different sort of Achilles heel. So that's why a consultation is so important. You have to sit down and look at, where is age being shown in that person in front of you? Is it that their skin? So we've seen, you know, 20-year-olds that have the skin age of someone who's 50. So for that person, those skin things are going to be vital. And then we've seen, you know, 40-year-old people who have fantastic structure centrally, you know, great cheekbones. The forehead is still well preserved, but in their family, they tend to have smaller chins. So where is that person going to show age that's sort of dissonant from the rest of what they're doing? Could be the chin. So that's why some of these sort of paint by numbers or cookie cutter approaches don't look right on every person, because every person's different, right?
Well, yeah, and not every 30-something-year-old needs cheeks, right?
No.
And oftentimes I find, you know, like we talked about earlier, those are the women in particular that they're starting to like that they look a bit more contoured, right?
Yeah, we've had a few people come after, you know, where we do a lot of corrective work and so on and so forth, but at 30, 35, as I was saying, I think people look their best with that lovely visual contour. And if you're volumizing an area and creating too much, almost infantile look,
too round,
it doesn't, not everybody's comfortable with that, right? Not everybody's comfortable with that. So it's again one of those things where a discussion has to be had, right?
Yeah. And then I guess the other thing we wanted to talk about a little bit today was just the fact that, you know, our approach is really that we're wanting to work on that longitudinal process, right?
Yeah. Yeah, for sure. We have, over the next month, if you are following us, if you're here on our video, you probably are following our social media profiles, but we'll be highlighting people that we've worked with for years. A lot of the fears that people have about aesthetics is that over time they may end up looking not like themselves, and that's really not, if you're doing a physiological approach to rejuvenation and restoration, you should always continue to look like yourself. You may not look 20, but that's not really what most people's goals are. They just want to look refreshed, and they want their appearance to be contiguous with how they're feeling inside, right? So over the years, you should continue to look like yourself. And so when we have a plan, it may start with your skin, and then we may say to you, you know, looking at your structure, this might happen, and if you want to prevent this, this would be our approach or our suggestion. And so we work very longitudinally. It's not a come in one time, do a whole bunch of things, and then see you later.
Well, we don't, but that's not how we age either, right?
No, it's not. No, it's very gradual, right?
Yeah, it just sneaks up and bites you.
Yeah, exactly. Until one day you're like, I can't take this anymore.
Yeah. So that's what we love to do, right? And I love doing the consults because it's a great chance to just let people kind of tell me what bugs them, right?
Totally,
and learn more about people. And, you know, a lot of times it's the same thing from one, you know, appointment to the next. But it's interesting because I think, there's the medical piece to this, of course, and then there's the aesthetic piece to it, and then there really is the psychology piece to it. Right?
Yeah, for sure.
Why? why are they here? You know, it could be maybe they don't want to be in pictures with their kids,
Yeah,
right?
that's an interesting one too, right? Yeah.
Right?
So if you can, yeah, I was actually listening to this podcast today about a woman who made a movie about her father who was slowly passing away from Alzheimer's. But that is having those memories is a really precious gift that you can give to your children as well as, you know, for yourself, right?
Yeah.
And if you're spending a lot of time avoiding any memories that you can create that way, it's not always the best. So it's nice when you can help people get over things like
Yeah,
that.
there's so many reasons people, you know, decide to have come in and talk about these things that are
Yeah,
bothering them. And
yeah.
I
So
don't I don't think it's vanity. I think it's about trying to look as healthy as you can.
yeah, for
You know?
sure. For sure. Yeah. So,
So
you know, the millennials don't have any guilt about any of this stuff. And
those jerks, they're not going to age at all.
no,
Yeah. Yeah. So I think this is going to be a fun series.
it is.
So next week we're going to be on again, and we're going to do a little deeper dive, right? You
That's
want to
right.
talk a little bit more about
Yeah, I think we're going to go
structural
further
changes?
into why do I, you know, people will say, why do I look so